Hello everyone, in this video we are going to practically demonstrate the 4 best home exercises that can be prescribed to patients who complain of upper back pain. The exercises that will be demonstrated in this video are based on the Mckenzie concept of treatment and are intended to improve the mobility in the upper thoracic spine. The ideal patients who are going to get benefited from these home exercises are those who have to work for prolonged period of time in sitting posture. And these are those patients who have developed increased thoracic kyphosis, rounded shoulders, and forward head postures. So let's start with the practical demonstration of these 4 excellent home exercises which can relieve upper back pain. The first exercise is the thoracic spinal extension exercise in erect sitting position. In this, the patient is going to be in the short sitting position with the thigh fully supported. It should be noted that during the sitting position, the patient should neither be in posterior pelvic tilting nor be in excessive anterior pelvic tilting. The patient should be educated about the concept of neutral pelvis, that is, once we take the patient into the overcorrected position, patient needs to relax around 10% from here, and this is his neutral sitting position. From here, the patient is going to be asked to clasp or interlace both the fingers and place it on the occiput. And now from here, the patient is going to be instructed to retract the chin and hollow the abdomen to fire up the abdominal or the core muscles. And now the patient is going to be asked to try and look as far as possible behind or backwards. And this is going to produce the extension in the upper thoracic spine and come back. Another important thing is that this exercise needs to be integrated with the breathing. So every time the patient is going to inhale and go backwards into thoracic spine extension. The chin retraction position is going to be maintained throughout the exercise. So retract your chin, keep the abdomen hollow and breathe in and go back. Stay there for a second or two, exhale and come back to the starting position. Perform this exercise for at least 10 repetitions, 3 to 4 times a day. The second home exercise that can be prescribed to upper back pain patients is thoracic extension exercise in supine lying position. So for this, the patient is going to lie down on the back in such a manner so that the back is cleared up to the T3 or T4 level. So the spine of the scapula is actually going to be out of the couch. The patient is going to support the head using one of the hand, and this is going to be our starting position for the exercise. From here, the therapist is going to instruct the patient to tuck or retract the chin in and then let go the head and neck as well as the upper thoracic spine into extension position. Stay here for a second or two and then again come back to the starting position. Again, breathing is important to be integrated with the exercise. So just breathe in and produce that thoracic extension movement. Breathe out and come back to the starting position. Now please do note that this exercise can be prescribed as both a static or a dynamic version exercise. So if we are just tucking the chin in and going down, staying here for a second or two and coming back, this is the dynamic exercise. And if we prescribe the patient to tuck the chin in, go down and hold this position for around 20 to 30 seconds, then this is going to become the static thoracic extension exercise. And both are going to be beneficial for upper back pain patients. The third home exercise is thoracic extension exercise in prone lying position. For this, the therapist is going to instruct the patient to lie down on the abdomen in the prone lying position. And now from here, keeping the hands under the shoulder, the patient is going to be instructed to push down on the couch and get up into the spinal extension position as far as possible, trying to look up towards the ceiling. Care should be taken that the pelvis should remain in contact with the treatment couch. And now from here, after staying for 1 to 2 seconds, the patient is going to go back towards the starting position. Breathing is again important, so every time the patient is going to inhale and come up, stay here for 2 to 3 seconds, exhale and go down. The fourth and final home exercise for upper back pain patients is thoracic rotation exercise in erect sitting position. So again, for this, the patient is going to be in the short sitting position, thigh supported and pelvis in the neutral position. Both the fingers are going to be interclasped or interlaced and kept under the chin, and the elbows are going to be pointing in the outward direction. Now here it is important to decide which side the rotation exercise should be prescribed. So let's say here the pain is on the right side, so the patient is going to tuck the chin in, exhale and rotate towards the right side as if he is trying to hit someone with the pointed elbow in the backward direction, and again inhale and come back. The effect of this movement should be noted on the pain after 10 repetitions, and if it relieves the symptom, the exercise can be done at home environment. Also, please note that for some patients, it can be possible that they get more relief while performing the thoracic rotation exercise on the contralateral side. So this should also be kept in mind while prescribing the home exercise to such patients. So for the right side medial scapular pain, some patients might experience more relief in their symptoms while rotating to the contralateral side. So these are the 4 best home exercises that I often prescribe to upper back pain patients, and they give good results. Do try them and let us know your valuable feedback. See you all in our next video. Till then, keep learning, keep sharing and stay connected.